Good afternoon to all. Myself, Dr. Deepak Kumar Parhi, professor in Department of Cardiology in IMS and SAM Hospital, Bhubaneswar. So today we will discuss about the management of hypertension in diabetic patient and what the RSSDI recommendation in 2022. You know that this hypertension and diabetes are the two leading lifestyle diseases in Indian and the South Asian population that often coexist due to the overlapping pathophysiological factors. Obesity, insulin resistance, inflammation, and oxidative stress are thought to be some common pathways both in diabetic and hypertension. Up to 50% of hypertensive cases in India are diagnosed with type 2 DM. In the recent RSSDI guidelines in 2022, which provide a comprehensive recommendation for managing hypertension in patients with diabetes. As per the Indian guideline of hypertension, hypertension is defined as systolic blood pressure of more than equal to 140 millimeter of mercury and diastolic blood pressure more than equal to 90 millimeter of mercury. The primary hypertension is mostly asymptomatic, while secondary hypertension is due to the various underlying pathophysiologies. And the uncontrolled blood pressure despite the use of 3 antihypertensive drugs with 1 diuretic, which is referred to as a resistant hypertension. Over 1 billion people who suffer from hypertension globally, which is expected to rise up to 1.5 billion by 2025. And up to 50% of cases of hypertension are also diagnosed with type 2 diabetes. And hypertension presents as a major risk factor for heart failure, the cardiovascular disease, the chronic kidney disease, peripheral artery disease, also in some end organ damage. There is a complex cause-effect relationship between hypertension and diabetes, which predisposes the patient to increase the risk of cardiovascular complications. For patients with diabetic and hypertension, 24-hour ambulatory blood pressure monitoring is recommended to maintain the blood pressure target of systolic of 120 to 130 and diastolic of 75 to 80 millimeter mercury. And the use of an annualized sphygmomanometer must be preferred over the digital devices. However, digital machine may be preferred for home-based measurement. Blood pressure thresholds vary with age and also in some comorbid conditions. Non-pharmacological management of hypertension in diabetic patients, like lifestyle modification, may delay the need for pharmacological intervention or can complement the blood pressure lowering effect of drugs. A low sodium diet, physical activity, and healthy diet are recommended to manage hypertension in diabetic patients. Pharmacological management of hypertension in diabetic patients. The ARB are recommended as choice of therapy, preferably in combination with calcium channel blocker to manage hypertension and its resulting complications. For combination therapy, the newer calcium channel blockers such as the ephedrine, cilnidipine, along with ARB are recommended. Cilnidipine is a novel, effective, and safe calcium channel blocker, which has established its renoprotective benefits and also the ephedrine. Combination therapy with ARB with thiazide-like diuretic also reduce the risk of the renal disorders. Telmisartan can be the first-line ARB for treatment of diabetic hypertension due to its beneficial effect on fasting blood glucose and insulin level. Alternatively, the Angiotensin with a similar safety and efficacy profile is also recommended. ACEi inhibitor may be used as an alternative to ARB for CVD risk reduction in high-risk patients. Beta blocker may be preferred in patients who have previous history of CVD and as an alternative to RAS blocker in all pregnant women. So to summarize, hypertension is a strong modifiable risk factor for the macrovascular and microvascular complication of diabetic, and strong evidence from clinical trials and meta-analysis support the targeting blood pressure reduction to at least 140 by 90 millimeter mercury in most adults with diabetes. Lower blood pressure target may be beneficial for selected patients with high cardiovascular disease risk if they can achieve without any undue burden, and such lower targets may be considered as an individual basis. In addition to lifestyle modification, multiple medication classes are often needed to attain this blood pressure goal and to prevent the complications related from these diabetic and hypertension. Thank you.